years of their lives to fighting polio, and without whom today would not be possible. I know there are many people following us in many different countries, and I would like to pay tribute to them. Thank you. To begin today's event, we will be watching a short video with representatives of polio eradication programs in Africa, indicating what has to be done in order to halt wild polio virus in the region. I will now give the floor to the Secretariat so that they can show us this video. Secretariat, kindly show us the video.
Ridding a continent of wild polio, one of the most devastating diseases of all time, is one of courage, resolve, and collaboration.
August 25th, 2020 marks a huge day in the history of the fight against polio. After 4 years without a case of wild polio, the WHO African region has finally been declared free of wild polio virus.
Only a generation ago, in the early 90s, wild polio was paralyzing 75,000 children every year in Africa.
I was hospitalized for 2 full years. I was just sleeping in bed without even being able to turn your head, nothing. All I could do was just to talk, but I couldn't even move any part, even my fingers. I couldn't feel anything.
In 1988, the World Health Assembly endorsed a resolution to eradicate polio worldwide, launching the Global Polio Eradication Initiative.
In 1996, the African heads of state came together in Cameroon to declare their commitment to eradicate polio from Africa.
Also this year, the great Nelson Mandela, with Rotary International, launched the Kick Polio Out of Africa campaign, uniting Africans together behind a common goal: to vaccinate every child against polio.
Across the region, we saw an increase in investment, leaders rallying together, and communities mobilized all across Africa for polio eradication. We started to see a decline in the number of polio cases. It is then that we realized that it was possible to eradicate polio from Africa.
In many parts of Africa, there are areas of conflict, and anywhere there's conflict, then there's always that challenge to accessing children. You have areas that are hard to reach. There are geographical areas that have water, mountainous areas, desert areas.
It was necessary to use several means of transport, for example, cars, motorcycles, and even more. We used canoes, motorized or not, to transport vaccines to where the children are.
Reaching every last African child with the polio vaccine has required countless acts of extraordinary bravery.
There was an attack or bomb blast, and 1 hour after, the teams continued their work. Whatever achievement we have made, I give it to these frontline health workers. They are the heroes that have made polio eradication to be possible.
This is a story of innovation and communities coming together towards one unified goal.
It was the implementation of community-based vaccination and also the improvement of epidemiological surveillance so that we could have a proper response.
Eradication has been a truly collective effort.
This is thanks to the governments, donors, non-governmental organizations, communities, and their leaders who have been with us every step of this journey.
Today, health systems and public health programs are much stronger because of the vast investments made to eradicate polio.
The polio eradication program has a huge footprint of expertise and infrastructure. As we speak, the polio infrastructure is being used to respond to the COVID-19 response.
We must continue to protect Africa's children against all forms of polio and other childhood diseases, ensuring they are protected by immunization. And we must take the lessons learned and best practices from eradicating wild polio virus to achieve Africa's other public health goals and improve healthcare for all Africans.
Merci.
Thank you very much for this very inspirational video. As we have just seen, it shows us the incredible journey required to achieve a wild polio-free Africa. I have now the pleasure of giving the floor to Professor Rose Leakey, Chairperson of the African Regional Certification Commission for Polio Eradication, who will tell us about the essential work that this commission has carried out in order to achieve today's results. Professor Leakey, you have the floor, please.
Thank you very much, Madam Chair. I'd just like to say I have with me here our Minister of Health in Cameroon, Dr. Manaouda Malashi. Thank you, yes, sir. Your Excellencies, ladies and gentlemen, distinguished guests, on behalf of the Africa Regional Certification Commission for Polio Eradication, the ARCC, I would like to thank you for inviting us to present our findings today. Let me start by a quick introduction of the ARCC members. The group includes Professor Jean Kabore, Burkina Faso, Dr. Arlene King, Canada, Dr. Mark Palanche, USA, Professor Yewale Tomori, Nigeria, Dr. Abduli Jack, Gambia, Dr. Bijan Sadrizadeh, Iran, Dr. Ibrahim Akan, Mauritania, Dr. Nadumba Edward Kironde, Uganda, Dr. Raul Jorge Lopez Feu, Angola, Dr. Supamid Chunsutiwat, Thailand, Dr. Zakaria Maiga, Mali, Professor Bogre Kwashi, Cote d'Ivoire, Dr. Ngokana Nkomo, South Africa, Dr. Rudolf Tangerman, Germany, Professor William Bahati Matuja, Tanzania, and myself, Professor Rose Ghana Fombanleke, as chairperson from Cameroon. The dream of a polio-free world started with the landmark resolution of 1988 during the 41st World Health Assembly, when 166 member states endorsed the resolution to globally eradicate wild poliovirus by the year 2000. In 1996, at the 32nd Ordinary Session of the Organization of African Unity, OAU, heads of states and governments signed a Yaoundé Declaration in Cameroon to commit themselves to eradicate polio from Africa. It is a personal honor that as the chair of the ARCC, I am a Cameroonian speaking to you today from Yaoundé, where this historic declaration, the Yaoundé Declaration, was made. President Nelson Mandela then followed on and launched the Keep Polio Out of Africa campaign. In 1998, the Africa Regional Certification Commission for Polio Eradication, ARCC, was established by the WHO Regional Director for Africa, the late Dr. Ibrahima Malik Samba, then continued under Dr. Luis Gomez Sambo, and finally now with Dr. Machidi Somoeti. Our mandate is to oversee the certification process and serve as the only body to certify the WHO African region as free of the wild poliovirus. The ARCC is composed of 16 experts, I just named them, from 5 different WHO regions, and 2 of the commissioners, Dr. Arlene King and myself, are also members of the Global Certification Commission, the GCC. Over the past 22 years, the ARCC members have met annually and more recently 2 to 3 times a year, to review the complete documentation of selected countries, as well as the annual reports of all the 47 member states of the region. In October 2018, the framework for the certification of wild poliovirus eradication was endorsed by all 47 member states at the 68th session of the WHO Regional Committee for Africa. With wild poliovirus types 2 and 3 declared to have been eradicated globally in 2015 and 2019 respectively, the last case of wild poliovirus type 1 in the African region was detected in Nigeria on August the 21st, 2016, and the last virus detected in a healthy child on the 27th of September, 2016, in the same state in Nigeria. In August 2019, the region completed one of the regional certification prerequisites by passing 3 consecutive years without detection of any wild poliovirus cases in the presence of adequate surveillance, including in high-risk areas, while achieving good routine immunization coverage. Over the years, the ARCC has been in the field in many countries to verify data and make recommendations on improvements to surveillance, immunization, and data quality in the region. These field visits, I must say, have been very helpful in giving us the confidence as we've worked towards certification challenging. And in some instances, we had to travel by helicopter to verify data in insecure and inaccessible areas. On June 18, 2020, after rigorous investigation and meticulous data verification, this commission accepted the documentation of the last 4 countries in the region: Central African Republic, Nigeria, South Sudan, and Cameroon. On August 18, 2020, this commission convened to review the latest updated annual reports from all 47 countries, supporting their claim of maintaining the wild polio-free status through sustained certification standard disease surveillance and improved immunization coverage. Today, we, the members of the ARCC, having considered the criteria, conclude that indigenous wild poliovirus transmission has been interrupted in the WHO African region. On behalf of all the ARCC members, I would like to congratulate all heads of states, heads of governments, and ministers of health on this achievement. We would also like to commend all Global Polio Eradication Initiative partners and donors on their relentless efforts. This historic milestone on the path of global polio eradication would not have been possible without the support of parents and community leaders, community health workers, as well as the work of frontline health workers and polio survivors, not forgetting communities themselves. To each and every one we say, thank you immensely. The ARCC would also like to pay homage to the polio heroes and champions who didn't live to see this moment, the frontline workers and staff who lost their lives in the course of carrying out polio eradication activities in the region. I also pay homage to the members of the ARCC who started with us on the certification journey, but who are no longer members today. Professor Francis Nkrumah of Ghana, Professor Amadou Diop of Senegal, Dr. Beatrice Amadi, Zambia, Professor Jackson Natu of Zimbabwe, Professor Rida Tekle Haimanot of Ethiopia, Professor Monda Eli of Cameroon, Dr. Ocheng of Kenya, Dr. Almazro of Emro, as well as former members of the National Certification Committees, NCCs, National Polio Expert Committees, NPEC, and the National Task Force, NTF. We also remember today the late members of the ARCC, Professor Joseph Ando of Cote d'Ivoire, Professor Mafoyane of South Africa, as well as the late members of the polio committees, NCCs, NPC, NTF, who dedicated their careers to polio eradication. And in particular today, I do remember Professor Joseph Lidi of Cameroon. As we celebrate the certification of the interruption of wild poliovirus transmission in the region, the ARCC would, however, like to use this occasion to share our concern regarding two key challenges: the ongoing outbreaks of circulating vaccine-derived poliovirus, as well as the impact of the COVID-19 pandemic on surveillance, outbreak response activities, and immunization coverage. We hope that the diligent efforts of the Africa Polio Rapid Response Team, with the full support and engagement of the affected countries, will result in these outbreaks being thwarted as soon as possible, and that plans for resumption of polio eradication activities amidst the COVID-19 pandemic will be urgently crafted. To conclude, the ARCC would like to encourage member states to use the lessons learned from the polio eradication efforts to eradicate other vaccine-preventable diseases and improve on health systems across the world. Your Excellencies, ladies and gentlemen, with these remarks, it is now my pleasure and honor on behalf of the Commission to hand over the report, conclusion, and certificate to the WHO Regional Director for Africa, Dr. Machidi Somweti, concluding that today, the 25th of August, 2020, the ARCC certifies that the WHO African region has interrupted the transmission of indigenous wild poliovirus. Thank you very much for your kind attention, and congratulations to all who have made this historic public health achievement a reality for us all to witness. I thank you.
How could they crowd themselves like that?
Merci infiniment, Professeur Leke.
Thank you very much, Professor Leke. Congratulations to us all. I now invite Dr. Matsidisha Mweti, WHO Regional Director for Africa, to take the floor. Dr. Mweti, you have the floor.
Your Excellency, the President of Nigeria, Mr. Muhammadu Buhari, Honorable Ministers of Health, Professor Rose Leke, the Chairperson of the African Regional Commission for Certification of Poliovirus Eradication, and esteemed Commission members, dear leaders and partners in the Global Polio Eradication Initiative, Rotary International, the US CDC, UNICEF, the Bill and Melinda Gates Foundation, and Gavi, the Vaccine Alliance, Dr. Tedros the Director General of WHO, the US Secretary of Health and Human Services, Mr. Aliko Dangote and Mr. Bill Gates, our leaders who have so inspired and supported this movement, Dr. Luis Gomez Sambo, distinguished health workers, polio survivors, colleagues, guests, and friends. It is among the greatest honors of my life to join you for this celebration of the eradication of wild polio virus from the 47 member states of the WHO African region. This is the second virus to be eradicated from our continent after the eradication of smallpox 40 years ago. For me personally, this is an incredible and emotional day as I stand in my late father's footprints. He was a Southern Africa member of the Global Commission that certified smallpox eradication. Little did I know when I was listening to his stories of trekking out to remote communities chasing after smallpox, that I would one day be reporting that Africa is free of wild polio virus. Today, we reap the fruits of a promise made 24 years ago by African heads of state to future generations. It has been a remarkable journey of perseverance, of innovation, and of sacrifice. At times, it was difficult to see if we would be making progress, particularly in settings of active conflict and where large numbers of people were displaced and inaccessible. In working towards this goal together, we have averted 1.8 million cases of paralysis among children, and in doing so, deployed 9 billion doses of the vaccine. My warmest congratulations to all the governments, the heads of states, the ministers and their staff, to our partners, to community leaders, to frontline health workers, polio survivors, caregivers, community volunteers, and individuals for rallying together to eradicate this virus. I pay special homage to the frontline workers who gave their lives in fighting polio. The eradication of wild polio virus from Africa is an example of what we can achieve with international solidarity. It is a vivid reminder that vaccines work and that the collective actions of communities, governments, and partners about PV2 due to low immunization coverage and PDPV2, with for agreeing to resume the campaigns to protect vaccinators and response to outbreaks, and in making our societies more equitable, particularly for the most vulnerable among us. I'd like to say a special word of thanks to His Excellency, the President of Nigeria, for having shown this remarkable leadership despite the reverses that we suffered together, and for being with us today. With these remarks, I accept the presented report, conclusion, and certificate by the Africa Regional Commission for Certification of Polio Eradication, and hereby concur and officially declare to all 47 member states that the WHO African region is certified free of wild polio virus. Congratulations, and thank you all. You have truly made Africa proud. Thank you very much, Madam Chairperson.
nous sommes tous autorisés à allumer nos micros pour applaudir à
We can all applaud, light up our microphones and applaud this momentous occasion.
¡Viva África!
Están aplaudiendo.
Congratulations, Africa.
Congratulations.
Pero han declarado canción.
La erradicación de la poliomielitis es una
Merci à tous pour cette célébration.
Thank you very much. Thank you very much for expressing your congratulations. Thank you very much, everyone. Thank you, Dr. Mweti. And congratulations to you for this great achievement. I would like to congratulate everybody, each and every one of you who contributed to this. Could the Secretariat please project up the certificate of eradication up on screen again so that we can truly appreciate this momentous occasion? Could we have the certificate on screen, please?
Il me plaît à présent de passer la parole au directeur général.
I am now happy to give the floor to the Director General of the WHO, who is also the chair of the Polio Oversight Board. Dr. Tedros, you have the floor, please, sir.
Thank you. Thank you, my sister. Your Excellency, President Muhammad Buhari, President of Nigeria, Your Excellency, the RC Chair, Dr. Jacqueline Lydia Mikolo, and Professor Rose Lake, the Chairperson of the Commission, and Bill, and my regional Moeti, Excellencies, friends, and colleagues. Today is a day of celebration and day of hope. Today, we come together to rejoice over an historic public health success, the certification of wild polio virus eradication in the African region. On behalf of the Polio Oversight Board, our partners at Rotary, CDC, UNICEF, the Bill and Melinda Gates Foundation, and Gavi, and all donors and partners, I congratulate the people and governments of Africa has only been possible because of the power of partnership, the power of solidarity. Since 1996, almost 9 billion polio babies. The substantial investments we have all made in defeating polio have delivered a rich reward. And although wild polio has been driven out of Africa, those investments will continue to bear fruit for many other health needs. The Global Polio Eradication Initiative has helped to deliver vitamin A, bed nets, and deworming tablets, and support for outbreaks, including Ebola. The COVID-19 pandemic is once again demonstrating that polio staff are an essential public health workforce that can be quickly mobilized to serve the most vulnerable communities. Local health personnel are conducting surveillance, contact tracing, risk communication, data management and reporting, as well as preparedness and coordination. The polio laboratory network with 16 labs in 15 countries is now dedicating 50% of its capacity to testing for COVID-19. Hundreds of tests are done each day using polio testing machines in Algeria, Cameroon, Cote d'Ivoire, Ethiopia, Madagascar, Nigeria, Senegal, and South Africa. The polio program continues to lead in engaging trusted voices on COVID-19, reaching and sensitizing health professionals and community influencers on the prevention and detection of COVID-19, while providing them with protective equipment and screening tools. My brothers and sisters, the end of wild polio in Africa is a great day, but as we all know, it's not the end of polio. 16 countries still face outbreaks of vaccine-derived poliovirus, and we have a hard road ahead to eradicate wild poliovirus from Afghanistan and Pakistan. As long as polio persists anywhere, it's a threat everywhere. We still have a lot of work to do to finish the job of consigning polio to the history books. We must continue to mobilize funds to strengthen health systems, especially for essential immunizations, to train health workers, to boost outreach services, and to listen to community concerns to counter misinformation. Yes, all of this costs money, but in the end, money spent eradicating polio is not a cost, it's an investment in a healthier and more productive future in which polio no longer robs children and prevents them from becoming everything they could be. A future without polio may have once seemed impossible. But in the words of Nelson Mandela, when people are determined, they can overcome anything. Thank you again. Merci beaucoup. It was such a great honor joining you, being from the same continent, from Africa. I join my sister how proud we are to see this day. Thank you so much again.
Merci, merci beaucoup, Dr.
Thank you very much, Dr. Tedros. This brings us to the next part of our program, where we will hear Muhammadu Buhari, President of the Federal Republic of Nigeria. Nigeria is the last country of the African region to have successfully eradicated and kicked out the wild polio virus. Your Excellency, President Buhari, the floor is yours.
Thank you very much. The Director General, World Health Organization and Chair Polio Oversight Board, Honorable Ministers, Senior Government Officials, Regional Director for Africa, World Health Organization, distinguished ladies and gentlemen. I am pleased to be part of this historic event to celebrate our collective achievement of wild polio virus eradication in Africa. It has been over 3 decades since the World Health Assembly passed a resolution to eradicate polio, and I am glad that the African region has finally reached this milestone. Let me acknowledge and commend my brother, President Cyril Ramaphosa of South Africa and Chairman of the African Union, under whose leadership Africa crossed the finishing line, a journey which Africa embarked on in 1996, when Nelson Mandela, of blessed memory, launched the Kick Polio Out of Africa campaign. This is indeed a truly historic event. I also congratulate Dr. Matshidiso Moeti and the World Health Organization Regional Committee for Africa for their untiring efforts, contributions, and leadership towards polio eradication in Africa. I recall that shortly after assuming office in 2015, I made a pledge to Nigerians that I would not bequeath a polio endemic country to my successor. This certification is therefore a personal fulfillment of that pledge to not only Nigerians, but to all Africans. At a time when the global community is battling with COVID-19 pandemic, this achievement strengthens my conviction that with the requisite political will, investments, and strategies, as well as citizens' commitment, will flatten the endemic curve. I can affirm the commitment of all African leaders in this course of action. We must guard this achievement of the eradication of wild polio virus in Africa jealously and ensure that we take all necessary steps to prevent a resurgence of this dreaded disease. This will require maintaining the highest quality of surveillance and sustaining population immunity through increasing routine immunization coverage and supplemental immunization activities. It is heartwarming to note how the strong partnership between the Global Polio Eradication Initiative and governments of African countries work tirelessly and collaboratively to deliver this success. Let me assure the global community that Nigeria will sustain the momentum and leverage on the lessons learned from polio eradication to strengthen our health system, especially primary health care, and prioritize health security. We use data systems, community engagement, and innovative technology to monitor and predict the occurrence of polio outbreaks. These same skills and tools are being used to fight COVID-19 and the multi-country outbreaks of circulating vaccine-derived polio viruses. I would like now to commend the dedicates of hard work and resilience of health workers and volunteers across the region, ministers of health and other stakeholders, such as political, traditional, religious, and community leaders who provided the required support and leadership. I would also like to appreciate the invaluable support of our donors, Rotary International, Bill and Melinda Gates Foundation, Aliko Dangote Foundation Union, Emeka Ofo Foundation, the Japanese and German governments that have made us triumphant in the war against polio. Finally, I congratulate us. Requires even more dedication. We must continue to vaccinate our children because vaccines save lives. We must continue to invest in our health systems because healthy populations creations. We must continue to build trust between government institutions, leaders, and citizens so that we can unite as a people and confront the health and socio-economic challenges we face together. Thank you, and God bless Africa.
Merci, Excellence.
Thank you so much, Your Excellency, Honorable President of the Federal Republic of the Nigeria. We were very inspired by your speech, ladies and gentlemen, ministers, heads of delegation. It is now time for us to hear from some of our key partners in the fight against Poland. The Global Polio Eradication Initiative leadership will present to you their statements during this section of the session. Let us start with two representatives of Rotary International. I would like to invite Mr. Holger Kanak, President of Rotary International, and Dr. Tunji Funcho, Chairman of the Nigeria National Polio Plus Committee, to take the floor. You have the floor, sirs.
Thank you, Chair Nicolo. Let's be honest. In the face of a pandemic, the world did not have much good news to celebrate in global health this year, and the challenges ahead are formidable. That's why we must recognize this great achievement and commend all of the people who played important roles in reaching out this milestone. It took tremendous effort over many years. Rotary and our partners began this mission more than 2 decades ago when we joined with Nelson Mandela to begin the work of eradicating the wild polio virus in the African region. Mandela inspired us all, and his support for this effort energized African nations and leaders across the continent to step up their efforts to reach every child with polio vaccine. And step up we did. To all our Rotary members, thank you for your continued support and dedication. We know this hasn't been easy, and there are still work to be done before we can fulfill our promise of a polio-free world. But you have helped achieve something remarkable. Rotarians have raised funds for polio eradication, advocated with world governments and local national leaders, held events and fundraisers for World Polio Day, and raised awareness of polio eradication. The dedication of Rotary members as part of our polio program has been central to the fight to end polio, and will remain committed until the end. And now I will turn over to Nigeria National Polio Plus Committee Chair, Dr. Tunji Funjo.
Thank you, President Holger. For more than 3 decades, Rotary members have been fully invested in polio eradication and have played an instrumental role in protecting children in the African region, from providing polio pluses such as soap and health kits, along with oral polio vaccine in camps for internally displaced persons in Borno State, to giving polio immunization during Health Day across Ghana, Nigeria, South Africa, and Uganda. Rotary members have shown resilience, persistence, and steadfast dedication to our top priority of ending polio. But we did not accomplish this alone. Tens of thousands of health workers have dedicated their lives to fighting polio throughout Africa. Thank you for your hard work. You have served as trusted voices in your communities and protected hundreds of millions of children from paralysis. Today's announcement is a big step in our journey to a polio-free world. But the fight is not over yet. We still need the support of our Rotary members, donors, and the heroic efforts of our healthcare workers to finish the job and eradicate the wild polio virus in every region of the world. There is one more big celebration to come when we eradicate the wild polio for good. We need your energy, tenacity, and commitment to protect children worldwide and rid the world forever of this terrible virus. Let us continue to work together to make polio a disease of the past. Thank you.
And it was showing signs. We thought it was internet.
I'll take that again.
Yes, you can, please.
For more than 3 decades, Rotary members have been fully invested in polio eradication and have played an instrumental role in protecting children in the African region. From providing polio pluses such as soap and health kits, along with oral polio vaccine in camps for internally displaced persons in Borno State, to giving polio immunization during family health days across Ghana, Nigeria, South Africa, and Uganda. Rotary members have shown resilience, persistence, and steadfast dedication to our top priority of ending polio. But we did not accomplish this alone. Tens of thousands of health workers have dedicated their lives to fighting polio throughout Africa. Thank you for your hard work. You have served as trusted voices in your communities to protect hundreds of millions of children from paralysis. Today's announcement is a big step in our journey to a polio-free world. But the fight is not yet over. We still need the support of our Rotary members, donors, and the heroic efforts of our healthcare workers to finish the job and eradicate the wild polio virus in every region of the world. There is one big celebration to come when we eradicate wild polio for good. We need your energy, tenacity, and commitment to protect children worldwide and rid the world forever of this terrible virus. Let us continue to work together to make polio a disease of the past. Thank you.
Merci, Monsieur Nak.
Thank you, Mr. Nak and Dr. Funsho. The role of Rotary International has been crucial in this endeavor to fight polio. I now have the pleasure to pass the floor to Madame Henrietta Faure, Executive Director of UNICEF. Madame Faure, you have the floor.
Thank you very much. It is an honor to join you today. We are certainly marking a special achievement. This wonderful milestone because of the thousands of health workers workers under the age of 5, these life-saving interventions. Village elders, radio broadcasters, fathers, and caregivers who listen to these voices. Children cannot get immunized without the support of parents and caregivers. So thank you to parents and caregivers who said yes when a vaccinator knocked on their doors. But our work is not yet done. While we've won the battle against wild polio in Africa, we need to build on our progress so far to win the war against all forms of polio virus on the continent. We must use the networks and pathways that we have created to deliver polio vaccines to continue the fight against other outbreaks like malaria and Ebola and measles. And to do so as we address a new threat, the COVID-19 pandemic, a global health emergency that not only threatens people's lives, it threatens to interrupt our work to deliver the polio vaccine and so many other life-saving interventions in Africa. But as we look for guidance, we can look to the spirit of Madiba. When he launched the Kick Polio Out of Africa campaign in 1996, the challenge seemed insurmountable. And now, 24 years later, we've proven that a polio-free Africa is within our grasp, that people can come together across the continent, from villages and towns and cities, to defeat a deadly disease. As we face COVID-19, we are summoning the same spirit. We've seen the very polio workers and networks that we've built together responding to the COVID-19 pandemic in Nigeria and many other countries. Together, let's reveal once again the power of African unity to gather people around a common goal and to build a better, healthier, brighter future for children and families across the continent. On behalf of the entire UNICEF family, congratulations to Africa and to the people of Africa on this milestone. We are very proud to be with you on this historic day. Thank you.
Merci, merci infiniment, Madame Faure.
Thank you so much, Madame Faure. It is now my pleasure and my honor to give the floor to Alex Azar, the United States Secretary of Health and Human Services. He will be followed by Dr. Robert Redfield, Director of the United States Centers for Disease Control and Prevention. Secretary Azar and Dr. Redfield will be giving you their remarks through pre-recorded videos.
As U.S. Secretary of Health and Human Services, and on behalf of the entire United States government, I want to congratulate all African nations on the continent's eradication of wild polio. This milestone is a testament to the tireless work of African governments, the Global Polio Eradication Initiative and its partners, and community, traditional leaders, healthcare workers. As the world's largest bilateral global health donor, the United States has been a leading supporter of polio eradication efforts, and that commitment will continue. I especially want to commend the political and technical partners who made this achievement possible. We saw this renewed political commitment in Nigeria quite clearly when President Buhari personally gave one of his grandchildren drops. I also want to thank the many frontline healthcare workers, often while working in difficult or dangerous conditions. I met and thanked many African health leaders and workers in the Democratic Republic of the Congo, Uganda, and Rwanda. On that trip, I emphasized America's commitment to strengthening Africa's health capacity. During COVID, even as much work remains, today is a historic day for global health, and it's a cause for celebration for everyone who works to improve Africans' health. Congratulations to everyone who helped make it possible. With that, I will hand things over to CDC Director Robert Redfield.
Today, we celebrate Africa's incredible public health achievement, interrupting wild polio virus transmission. On World Health Day in 1995, Nelson Mandela announced that South Africa would put its efforts behind achieving a world without polio. A year later, he launched the Kick Polio Out of Africa campaign. Today, that goal has been achieved. This milestone marks a huge step forward on the road to global polio eradication. Over 90% of the world is free from wild-type polio today. But the work is not done. To sustain this progress, each country must maintain high levels of protection against poliovirus through vaccination. We know and have seen that wild-type polio importations can occur in any country. And while the virus is still circulating in endemic countries, the world remains at risk. An urgent charge now for Africa is to rapidly stop circulation of vaccine-derived poliovirus outbreaks. For over 30 years, CDC has worked with countries and partners to eliminate polio in Africa. In December 2011, CDC activated its Emergency Operations Center to strengthen the agency's partnership engagement through the Global Polio Eradication Initiative. CDC has intensely focused on key priority areas to help reach this milestone, providing leadership and support for quality polio surveillance in the African region, serving as one of the 6 global polio special reference laboratories and being on the forefront of developing new diagnostic tests, introducing technology in the field to rapidly diagnose and respond to polio cases and outbreaks, providing scientific and technical guidance through the participation in the polio technical advisory groups for the Africa region and around the world, and strengthening the ability to detect and respond to the polio virus through CDC's flagship Stop Transmission of Polio, or STOP program. This moment is Africa's to celebrate and to savor, and I want you to know that CDC stands with you today until the day the polio is finally eradicated. The polio program has already created many public health legacies, which are being used to jumpstart critical surveillance and diagnostic efforts against other global health threats like Ebola, measles, and most recently, COVID-19. Polio workers and resources are playing an important role in the fight against COVID-19 and providing critical support to protect communities. I offer my sincere congratulations to all the nations in Africa and their leaders for their achievement in eliminating wild polio virus from their country and together across the continent. You have demonstrated how much can be achieved when determination, partnership, and resources come together, no matter the circumstances. The end of polio is closer today because we have all believed in seeing the possible.
Merci beaucoup.
Thank you very much to Secretary Azar and Dr. Redfield of the US CDC. I will now give the floor to Dr. Christopher Elias, President of the Global Development Division of the Bill and Melinda Gates Foundation, a foundation that was another key partner for the African continent in the eradication of polio. Dr. Elias, you have the floor, sir.
Thank you, Minister Makolo. It's a pleasure to be with you and Dr. Moeti and everyone else who's joining us from around the world today. Personally, I'm thrilled to participate in this historic event and want to begin by congratulating every country in the WHO African region for achieving wild polio-free certification. The progress made against wild poliovirus is a testament to your government's unwavering commitment to reaching every child with vaccines. It's also a powerful reminder of the importance of partnership and innovation in achieving global health triumphs such as this one. Today would not have been possible without the collaboration of governments, donors, health workers, traditional and religious leaders, NGOs, and the media, among countless others. I also want to recognize the work of the Global Polio Eradication Initiative in coordinating this incredible partnership. From the work of UNICEF in procuring vaccines and mobilizing communities, to Rotarians for their unwavering advocacy, for WHO and CDC for their technical and operational leadership, to Gavi for its work in financing and procurement of injectable polio vaccines, and to the work of national governments across the region for enabling accountability and demonstrating political will. But as you've heard, the work is not finished. This partnership is so important to tackling the critical risks that remain, keeping children safe from any importation of wild poliovirus, and finishing the job of eliminating circulating vaccine-derived polioviruses. We have a partnership and a strategy that works, and it will be critical that we use all of the tools and energy to make these remaining tasks, especially eliminating circulating vaccine-derived polioviruses, a thing of the past, and to do so as fast as we can. Innovation and ingenuity are also key characteristics of this program. There are so many examples. I especially like Avidar, a simple app created by the program on mobile phones and put into the hands of trained community volunteers, which allows them to report possible polio cases to the ministries of health in several countries across the region. Cases that might otherwise were using hand-drawn maps to identify settlements as part of their micro-planning for immunization campaigns. Now, similarly, many countries have been pioneers in the establishment of emergency operation centers. These have served. We have a partnership that tested. We at the Bill and Melinda Gates Foundation are
Merci beaucoup, Dr.
Thank you very much, Dr. Elias. And now we will be watching a pre-recorded video of Dr. Seth Berkley, as CEO of Gavi, the Vaccine Alliance. In celebration then of this very important landmark, we will now be watching the pre-recorded video.
Echo the previous speakers and congratulate the countries of the African region, including the legions of health and community workers, all levels of government, and the communities themselves for this momentous achievement. And yet today's celebration must be tempered by the expanding scope of outbreaks of vaccine-derived polio and the broader impact related to COVID-19. There is mounting evidence that the COVID-19 pandemic has had an unprecedented negative effect on primary healthcare systems, including the coverage of essential vaccines. And it's estimated that 80 million infants are at risk globally of getting common infectious diseases, many of which are vaccine preventable. Research underlines the disproportionate impact that COVID-19 could have on disadvantaged communities in low-income settings, the same communities that have fought so hard to rid themselves of wild polio virus and are now struggling to get ahead of vaccine-derived polio outbreaks. Equity and the need to reach these zero-dose and under-immunized children remain two of Gavi's key priorities for its next 5-year period. And the achievement of wild polio virus eradication in Africa can and should serve to re-energize and innovate our approaches to primary health care and comprehensive immunization delivery. In the wake of the pandemic, seeking programmatic and financial efficiencies through integrated service delivery and comprehensive vaccine preventable disease surveillance is more urgent than ever as we consider the sustainability of our achievements. Gavi, the Vaccine Alliance, is fully committed to working with countries to build and sustain the systems necessary to ensure that no one is left behind. We rely on the leadership of governments at the national and local levels, national programs, and the technical expertise of our partners to turn adversity and challenges into opportunities. The significant achievement strengthens our collective resolve and commitment to continue to improve and build the systems that are required now more than ever to not only stop circulation of all forms of the polio virus, but also of measles, yellow fever, pneumonia, and diarrheal diseases that continue to cause significant morbidity and mortality in Africa and other parts of the world. Thank you so much for all that you do, and thank you for listening.
Thank you very much to Gavi, the Vaccine Alliance, for this video. And this brings us to the end of the remarks by the GPEI leadership, that is the Global Polio Eradication Initiative leadership. Honorable ministers, distinguished guests, ladies and gentlemen, we will now move on to the next segment of our agenda, during which two key partners will discuss how to continue investing in immunization and public health so that the continent remains free of wild polio virus and other infectious diseases. I am honored to now give the floor to Mr. Alhaji Aliko Dangote, the Chief Executive of Dangote Industries Limited and Chairman of the Aliko Dangote Foundation, and also Mr. Bill Gates, Co-Chair of the Bill and Melinda Gates Foundation. We will begin with Mr. Dangote. Mr. Dangote, you have the floor, please.
Thank you for inviting me. This is a great day for Africa and the world, and I'm happy to witness the end of a scourge that has brought untold hardship on humanity. I want to commend our African leaders, especially my own President, Muhammadu Buhari of Nigeria, for his leadership. All levels of government have successfully come together to make this day possible. And much thanks to Bill, who has been a tremendous partner. He has helped us in this push to get rid of polio for many years now. I'm grateful for his support. The onus is on us to continue to push forward until polio in all its forms is gone forever. I have been in business a long time, and perhaps the most critical lesson I have learned over the years is that a country or continent's most valuable resources is always its people. Africa's young people will drive our continent's future success. It is our duty as leaders to invest now in their health and well-being. That is why I started my foundation in 1994 and why I've been pushing to eradicate polio across Africa for many years, because nothing is more important than the health of our children. Ending wild polio in Africa is a giant leap forward. We have shown that if we stay clear-eyed and committed to a goal, we can get results. We must always be tenacious to get where we want to go. I know Bill understands that too. We need to apply the same mindset on public health across Africa, beginning with us here today. So let's take this opportunity to reenact our commitment. One, we will end circulating vaccine-derived type 2 virus here, as we have ended wild polio. So long as children are paralyzed, our job is not done. We will end other communicable diseases in Africa, including COVID-19. We will also help every man, woman, and child live a healthy life. There is no better time than now. We must be dedicated to this fight and make the sustained investment in immunizations, medical workers, and public health that will make a difference. We must also make a sustained political commitment until the job is done, that we will achieve this goal, and that we will hold ourselves accountable for the results, whether good or bad. I also pledge to continue helping in any way. I also continue helping in this fight in any way I can. I believe the private sector and government are natural partners. So congratulations to all of us. Today we celebrate, and tomorrow we get back to work. I now have the great pleasure to hand over the microphone to my partner, my friend in this polio fight, Mr. Bill Gates. Bill, it's over to you.
Hello, everyone, and thanks for including me in this important celebration. I'm honored to speak today and to appear with Aliko Dangote, who's been integral to the success of this huge public health effort. Aliko and I became friends as soon as we met. Since then, we've had a chance to travel together across Nigeria and Chad several times to support our joint work on polio eradication. We've had meetings with ministers, traditional leaders. We've visited health clinics and surveillance sites and put in some long days. And I know he's as delighted as I am that we've reached this critical milestone. 30 years ago, more than 40 people worldwide contracted polio every hour. Even in 1996, wild polio paralyzed more than 75,000 children across Africa. Today, wild polio in Africa is gone. This is an historic milestone and a public health triumph for Africa, one that has and will continue to pay dividends in the fights against diseases like Ebola and COVID-19. We're not done yet, of course. Now more than ever, it's important to protect the progress we've made. We still have to beat wild polio in Pakistan and Afghanistan, because until polio is gone everywhere, it can still return. And the global polio program has to contend with another less common type of polio, CVDPV. These viruses continue to spread in a number of countries, mostly in Africa, and require coordinated efforts and financial support to end them too. But let's be clear, today is an amazing achievement that is going to mean a world of good for the children of Africa. I think of the kids I met in Lagos with routine immunization now t-shirts and in clinics in Sokoto and Abuja. They are that much closer to a world without polio. There was nothing inevitable about this moment. If African nations hadn't come together to stop outbreaks across the continent and reach millions of children who had never been immunized, wild polio would still be a huge issue. We're here today because all of you and many more work together to end this disease. We're here today because of the hard work, commitment, and coordination of millions of people across Africa, political, traditional and religious leaders, donors, and public health advocates, organizations like Rotary, frontline health workers, and communities who worked to see every child vaccinated. It also took significant money and other resources. staying wild polio free and stopping CVDPV will mean continuing to invest in polio immunization campaigns and infrastructure. African governments will need to provide political and financial support to ensure that eradicating polio remains a top priority. But the value of these efforts, immunization campaigns, disease surveillance, social mobilization, and outbreak response, is incalculable. They've not only helped us beat wild polio, they have also built a stronger public health infrastructure across Africa, one that has helped fight Ebola and is playing a critical role against COVID-19. The COVID-19 pandemic is testing Africa and the world. We must find ways to both beat the virus and make sure we don't backslide on all our progress against polio and other diseases. It's going to be tough, but I'm confident we will prevail if strong immunization programs continue and improve in the many places where they remain weak. And that's why I think it's important today we are acknowledging this remarkable milestone. Africa is now free of wild polio because so many leaders and partners came together to defeat it. Country governments must continue to invest in public health, support the frontline workers, stay vigilant against outbreaks, and most importantly, work together. With the commitment of the international community, I'm confident we can make all forms of polio everywhere and COVID-19 things of the past. When we work together and stay committed, we can achieve amazing things. Today is proof of that fact. Thank you and congratulations.
Merci infiniment.
Thank you very, very much, Mr. Gates and Mr. Dangote, for your remarks, for being here with us today, for your generous contributions, and for the work championing wild polio eradication over the years. And thank you all, distinguished guests, for your invaluable contributions and tireless commitment. It is thanks to you all that we are celebrating this remarkable achievement today. But we could not conclude our special event without listening to someone that has personally experienced living with the wild polio virus, that today was certified to have been eradicated from the African region. I have the honor to give the floor to Senator Kipchumba from Kenya, a polio survivor and a longtime advocate for wild polio eradication. Senator Kipchumba, the floor is now yours. You have the floor, sir.
Thank you. Thank you. The Honorable Madam Chair, Your Excellency, distinguished guests, ladies and gentlemen. It is a great honor to be joining you today in celebrating a wild polio-free Africa. At the age of 4, what my mother thought was a normal malaise turned out to be a lifetime journey of pain and suffering. Yes, they diagnosed me with polio, which has no cure. No reason or excuse was spared to explain my illness. Even marriage abortion had taken place 55 years ago. I could have lived to my fullest potential. I could have become the army general that I dreamt to be. As a child, I missed the fun of growing up, running around, playing, and attending the nearest school in my village, which was 8 miles away. As a teenager, I was always one left behind by my peers when they went for adventures and hikes on the beautiful hills and valleys of Baringo. I found peace when I accepted my predicament and the fact that I have survived with a permanent disability. Sadly, fear gripped me when I learned that children were still getting infected and dying of polio and other vaccine-preventable diseases in this time and age, despite having a safe and effective vaccine. In 2013, Kenya had a new polio outbreak, and 14 people were paralyzed. Most of them were children. I decided to be part of the solution with the dream of having polio eradicated globally in my lifetime. I mobilized polio survivors in all their diversity to put a face to this disease and to share our stories. We reached out to parents, caregivers, cultural and religious leaders, NGOs, health workers, development partners, and governments through community engagements, mass media, meetings, campaigns, and lobbying. Sometimes there was opposition, but we strived on. To leaders, our rallying call was loud and clear. Immunization is not a choice. It is a right and a responsibility. To parents and caregivers, we pleaded that no child should undergo our pain. Never and never again. With this certification, I hope we will not close our eyes or turn away from Africa's primary health challenges. With COVID-19, we can easily lose our gains if we don't stay vigilant. We must not take our foot off the pedal. We need to strengthen routine immunization programs, enhance community engagements, improve disease surveillance, upscale mechanisms for emergency response, and resume vaccination campaigns. On this special day, I want to thank my family, my parents, my wife and children for their support through the years. I also greatly appreciate the role that the WHO, UNICEF, USAID, and the UN family, the Global Polio Eradication Initiative's partners have played, and the generous support of all donors and individuals. Thank you, the Dangote Foundation and Bill and Melinda Gates Foundations for having invested in health and leaving a footprint in humanity. Thank you for the commitment today. COVID-19 has complicated healthcare and daily life for millions. I plead to all public health leaders listening to me today to continue working on the provision of essential healthcare services uninterrupted and a vaccine developed in the shortest time possible. I want to appreciate COVID-19 has brought the reality that vaccines are important and everybody wishes there's one for COVID. But there's always vaccines every day for our children, and some do not take it serious. I call upon governments to prioritize immunization. Today, on behalf of the millions of voiceless Africa's children and polio survivors, I wish to propose a vote of thanks. I would like to thank all parents, volunteers, communities, and religious leaders, frontline health workers, health authorities, and heads of state of each of the 47 countries in the WHO African region who have worked collectively as one team to kick wild polio out of Africa. Thank you all. Asante sana.
Merci beaucoup. Merci beaucoup.
Thank you very much, Senator Kipchumba. It was a real pleasure to listen to your testimony. This brings us to the end of the special event for the celebration of the certification of wild polio virus eradication in the African region. We would like to thank His Excellency President Buhari for having honored us with his presence. Honorable delegates, distinguished guests, ladies and gentlemen, our dear donors, thank you. With a great deal of emotion, I would like to thank you all, and I would like to say huge congratulations on achieving this milestone. Once again, I think we can light up our microphones and applaud our achievements. This achievement, which has signaled the end of polio virus eradication. Thank you very much, and a huge congratulations to all.
Thank you, thank you, thank you.
Thank you, thank you, thank you.
Congratulations.
Thank you, thank you.
Thank you from South Sudan. Thank you from South Sudan.
Nous allons profiter.
Merci.
Nous allons maintenant profiter d'une pause de 5
We can now have a 5-minute break, which will enable us to prepare for the next session, which is the closure ceremony. We are ahead of time. We will begin our closure perhaps 10 or 15 minutes ahead of time. And I think that we can really congratulate ourselves on our achievements. And this will really help us to deal with the health situation in our countries. So we are going to resume at 17:55 Brazzaville time, 45, I'm sorry.
Okay, no. I'm so happy this RC is coming to an end. Okay, so it's still flickering. It's still flickering. I mean, it looks better. Oops, oh my goodness.
Thank you, Dr. Moiti. This is South Sudan. We are ever so grateful. You've done great today, all day. That was wonderful. Thank you.
Okay, thank you. Thank you very much, Minister. And congratulations to everybody. Congratulations to you, to everyone. It's such a great moment for all of us. It's amazing. Thank you.
Wonderful leadership from your side. The whole team from South Sudan is celebrating. The Minister of Health is representing the people of South Sudan on the achievements, and it is your leadership. You've done well. We've been with you throughout the day, and you've done well. Thank you.
Thank you. Thanks
Thank you.
very much.
Asante sana, they say.
Asante, Minister. Thank you.
Raise our hand.
You can just stop. The microphone is on. You can just stop.
Congratulations. Congratulations, Africa. Congratulations, my sister. Congratulations.
Congrats.
And thank you for all your support for Nigeria. We are very grateful. This is Ngozi Azoro representing the Minister of Health.
Well done.
Of Nigeria. Congratulations. It's a great day to be an African.
Okay, congrats, Nigeria. You kept going until the end.
Thank you. Thank you.
Congratulations, Dr. Moeti. Congratulations from Angola.
Oh, hi, Minister. How are you?
How are you? You have done a great job.
No, it's your job. It's your job.
It's our job.
Congratulations from Liberia.
Hi, Minister, too. So great to see everybody. It's wonderful. Well done. Well done.
Buenas tardes, Dr. Moeti. Congratulations.
Oh, Minister Diosdado. Thanks a lot. Welcome.
Hey, for all of us. Thanks to you. Thanks to Dr. Sambu, who was right there beside you.
Well done, everybody. You did great. Everybody.
Congratulations from Malawi.
Wonderful. Thank you. Congratulations to you, too.
Thank you.
Thank you.
Parabéns, Cabo Verde.
Ah, Cabo Verde, tudo bem.
Oh, Malawi. Oh, I see.
I was congratulating you and also extending my greeting to Dr. Sambo, whom I saw there. This is a good day, big day. You have done a good job, wonderful job. Thanks from Equatorial Union, all our children, they are thankful to you, to Dr. Tedros, to Dr. Sambo, Moneko, to Dr. Samba. All you have really worked for to see this great day.
Indeed, it's amazing.
Congratulations.
I'm lucky to be the one here when finally their hard work's fruition comes to pass. Really wonderful. It's great.
Congratulations from Eritrea. Thank you for your dedicated leadership, Dr. Mioti.
Thank you. Thank you so much. So great, Eritrea. Thank you very much. I appreciate it.
Welcome.
Senegal. Zimbabwe. Hey, Zimbabwe.
Hi. Yeah. Well, congratulations. Africa must be proud today and your leadership, Dr. Moeti. Thank you very much.
Oh, no, I'm very proud of Africa for the persistence. It was not easy. It really was not easy, but it's a great day, a huge achievement, really.
Oh, oui. Félicitations, félicitations, Madame la directrice régionale. C'est Dr Abaché, secrétaire général du ministère de la Santé publique du Niger. Toutes nos félicitations.
Merci, non. Merci, bon, c'est félicitations à vous.
Merci.
Qui ont fait le travail dur. Ah, je me rappelle au Niger.
OK.
À travers, OK. Merci.
Félicitations, Dr Abaché du Niger.
Oui, c'est bien lui.
Félicitations. C'est moi, Bolaji, du Nigeria.
Ah, mon frère.
L'ancien porte-vocal du Nigeria.
Comment ça va?
Ça va bien, merci.
Merci beaucoup. Toutes nos félicitations, congratulations.
Félicitations. C'est une bonne journée pour l'Afrique.
Merci, merci beaucoup.
C'est une bonne journée.
Merci, merci à vous aussi.
The screen. Huh? If I take it, show me holding camera. So take it and send me.
Okay.
So you get
Félicitations, Madame Weki. Félicitations, Madame Weki.
Merci beaucoup. Félicitations à vous, plutôt. C'est vous qui ont fait du travail. Merci beaucoup.
Oui, c'est toute la population.
Absolument. Merci.
Muito obrigado.
Tenez en principe.
Merci beaucoup.
I wish you can kick out poverty like this. Poverty, literacy, malaria, COVID-19. It is not. It's a goal. I wish we can kick out poverty, malaria. Everything takes a dream.
Congratulations, Dr. Mehdi.
Thank you. Thank you very much. Congratulations to you, ministers, and your staff, really, and our national leaders. Wonderful. Thank you. I think the chair wants to start.
Merci beaucoup à tous. J'ai voulu laisser encore quelques minutes.
Thank you, everybody. I'll give you a few more minutes for the mutual congratulations, because it is only right that we express satisfaction for the work done. But let us not forget that we still have a lot of other challenges to tackle. Ladies and gentlemen, we have now reached the closure of this virtual session of this virtual committee. In line with the resolution that we adopted this morning on the suspension of the virtual session of the regional committee, I will consult with the regional director who will communicate to you the dates for the resumed session of the regional committee. May I now request the regional director to address the regional committee. Dr. Moeti, you have the floor.
Thank you, Chairperson of the 70th session of the regional committee, the Honorable Minister of Health and Population of the Congo, Honorable Ministers of Health and heads of delegations, distinguished partners, guests, dear colleagues and friends. As we conclude this session, I'd like to thank you for the productive, insightful, and informative exchanges that we've had today. And I'd like you once again to congratulate all of you and our partners for our great achievement in eradicating wild polio virus from the region. The experiences and insights you've shared will contribute to shaping and improving our strategic approaches in the region and our work on the ground in countries towards defeating the COVID-19 virus and accelerating progress towards universal health coverage. The progress and achievements you have shared tell us that we are on the right track towards improving health outcomes. This year, more than others, we have been put to the test in responding to the pandemic. And as we continue to work quickly, adapting to new realities and ways of interacting and operating, I know that we are all focused on doing our best to protect the health of the communities that we serve. I'd like to thank all member states for your leadership, especially you, honorable ministers, and drive to achieve our shared goals and to appreciate the contributions of our partners whose financial and technical assistance plays such an important role in our work with countries to deliver results. A special thank you to the high-level representatives that have participated in our session on polio eradication today, namely His Excellency, the President of Nigeria, His Excellency, the Prime Minister of Ethiopia. I apologize to His Excellency, the Prime Minister of Mauritius, who had joined us for the last part of the session, which we did not have time to have. Mr. Aliko Dangote and Mr. Bill Gates, the leadership of the Global Polio Eradication Initiative and heads of agencies of our Harmonization for Health and Africa Partnership, particularly my two regional directors from UNICEF and the other agencies who've been such steadfast partners to our work in supporting health development in Africa. Taking action for better health and well-being really is a whole of society effort. And it's encouraging to know we have a network of engaged supporters working with us. So I'd like to appreciate the 37 non-state actors, the 5 UN agencies, the 9 observer member states from outside of our region, the Holy See, and as a non-member state observer, who have all joined us for this session today. Thank you so much to the members of the media for the sustained and scientific reporting on the COVID-19 pandemic and for your efforts to ensure that other significant health issues like the Ebola outbreak in Equator province in the Democratic Republic of the Congo also garnered attention in the press. Thank you to the many colleagues involved behind the scenes in organizing this meeting, including our governing bodies team, the translators and interpreters, and staff at the country, regional, and global levels who have contributed to making this first virtual regional committee a success. I also want to appreciate the steadfast leadership, partnership, and friendship of the WHO Director General, Dr. Tedros, particularly his advocacy and support to advancing priorities and addressing challenges in African countries. Tedros, you belong to us, even as you belong to the whole world. While the challenges we face are great and the stakes are very high, by remaining focused on our collective goals, using evidence-based approaches, incorporating new technologies, and most importantly, engaging and enabling communities, I'm confident that we can make strides towards universal health coverage and better health and well-being. I was so encouraged by the recurrent calls from you ministers to work together across boundaries, to exchange capacities, to exchange experiences and ideas. And we in WHO, working with our partners, will support those processes because it's together that we are going to succeed in improving health on our continent. I'd like to apologize to our panelists that we had invited to the last part of the COVID-19 special event and say that we value your contribution, the actions that you are taking. It is very unfortunate that we were so enthusiastic that we did not spare the time to hear from you directly. I look forward to our resumed session of the Regional Committee, which will be in November, focusing on the program budget implementation and planning for the next biennium and the evaluation of the COVID-19 response. I'd like to end again by encouraging our member states. We will be in touch with you about the next phase of gaining access to COVID-19 technologies, particularly the vaccine. And just to emphasize, there is a time limit to your responses. We encourage you, please, to be very quick in showing your commitment to gaining this technology, which will be so important. I wish you all good health, that you stay safe and take care as we continue working together for good health in the African region. And I thank you very much, Madam Chair. Thank you.
Merci beaucoup, merci infiniment, Dr. Moeti.
Thank you, Dr. Moeti. I shall now have the honor of delivering the closing address. Director General of the World Health Organization, dear Dr. Tedros, Commissioner for Social Affairs of the African Union Commission, Honorable Minister of Health of Togo, Regional Director for Africa, honorable ministers of member countries of the Africa region, dear colleagues, distinguished delegates to the 70th Regional Committee, dear partners, distinguished guests, ladies and gentlemen. We have come to the end of our virtual session of the RC70, which was marked mainly by two topical events, the special event on COVID-19 and the celebration of the eradication of wild polio virus from the Africa region. After more than 10 hours of intense work, it gives me great pleasure and honor to preside over the closing of this virtual session. Allow me to express, as chair of the 70th session of the Regional Committee, to express my sincere appreciation for the quality of interventions of member states. Let me mention the record participation. We have 47 countries represented. We also received 47 credentials. This is unusual. So congratulations to all the member states that showed special interest in this virtual session. I would also like to congratulate once again the Director General of the WHO, Dr. Tedros Adhanom Ghebreyesus, for his clear leadership on the response to COVID-19 in our member states, especially the ratification of the Convention on the African Medicines Agency. My gratitude also goes to Dr. Matshidiso Moeti, Regional Director for Africa, for the quality of results obtained and presented in her activity report 2019-2020. In these unprecedented times, for all the declarations of member states, I note a number of challenges that we need to address. They include the need to give more support to states affected by armed conflict and disasters, decentralization of screening methods, and improvement in the offer of services in our states, better resource mobilization through the implementation of programs beyond those of response to COVID-19, the use of modern technology as part of the response to COVID-19 in our states, better participation and community engagement in our states, improved epidemiological surveillance in all our territories and especially at the borders, responsible management of travelers in respect of international health regulations, and improved access to COVID-19 vaccines. Ladies and gentlemen, we worked hard and vigorously as a result of our common desire to move closer to achieving universal health coverage in spite of the COVID-19 pandemic, so that nobody is left behind. Our deliberations have highlighted the importance and our interest in the health of our populations. The 70th Regional Committee has taken place in a very special context. In light of everything we have said, we believe in the future, and we believe that we have cause to be hopeful. The various reports presented and the experiences shared show that the progress we have achieved, thanks to the efforts of the countries and the support of our development partners, highlight also the traditional challenges facing our continent in the health sector. Without losing hope, we must work to make sure that our health systems are more resilient so that they can respond to the old challenges as well as to COVID-19. Ladies and gentlemen, I would like to mention that we do appreciate the support of the World Health Organization and of AFRO. I am convinced that this support will continue and be strengthened through the process of the transformation agenda of the organization. I am honored and encouraged to continue the mission of chairing the Regional Committee for Africa during this period. And I wish to seize this opportunity to thank and congratulate the vice chairpersons and the rapporteurs that have supported me during this virtual session. I hope I was able to meet up to your expectations in spite of the challenges during the session. Once again, I would like to thank the staff of AFRO and the WHO representation in Congo and all those who contributed to the preparation and holding of this virtual session. I'm also grateful to the technical and financial partners, to the private sector, and to the international and national press, as well as the civil society. Finally, I would like to thank all my colleague ministers and heads of delegation. On this note, I declare closed the virtual session of RC70. And I would like to now suspend the 70th session of the Regional Committee. Thank you for your engagement and your time. Thank you, everybody. Asante sana, Matondo Mimi. Thank you very much.
Thank you, Dr. Cecilia. Thank you, Dr. Moiti. Thank you very much.
Merci, Madame la Ministre.
Thank you. Merci
Madame la Présidente.
Merci beaucoup.
Thank you, Dr. Moiti.
Thank you, everybody. Thank you so much.
Thank you so much. Well done.
Congratulations. Dr. Moiti.
Congratulations, my sister, for a successful meeting.
Thank you. Thank you very much.